Hi, I'm Kevin Wasko. I'm a family physician who works in Swift Current predominantly, now in the emergency department, and recently crossed over to the dark side of administration as well. I've focused, exclusively on what I learned through this. I think I have my posters at the back, but some of the reflections on the learning process that I found most useful was that as I was going through CQIP, I'd also entered into a new career phase, and I was able to take some of these concepts that I was learning, take them away and not just apply them to the project, but to my day-to-day work, and I found that very beneficial. I found that in that process, by continually using these concepts, the lingo became a second nature, and I would encounter it over and over in other aspects of what I was doing. And the tools that I would learn became useful and applicable in multiple settings, and I think that's a real takeaway of this program, is that we can use these quality improvement tools in many different ways, whether it's the work we do clinically or even in our home lives. And I really think that a bottom line for me was that more was gained from these learnings through the workshops and through application than the project itself. I think the project was a means to an end, it wasn't the end, and I think you've heard that from lots of people, that the projects may not have wrapped up by the end of these 9 months, 10 months, but what we learned will carry us through. On my experience, I've learned that QI has its own language, and I'm unilingual, unfortunately, but I have heard from people who gain fluency in a second language that there becomes that aha moment where you're no longer stopping to translate things and that things just make sense. And I found that I achieved that at some point with the quality improvement lingo and the language and the terms. I didn't have to stop and say, what is that tool again, or what does that mean? It just becomes second nature, and I felt that I had achieved something when that occurred. That I am now more inclined to use these tools to work through problems. And a piece that was challenging for me was the data analysis. I found was one component where I don't think I'm really there yet in terms of it being second nature, because a lot of how I apply these are high-level conceptual usage. I don't, I guess, get into the minutiae much in terms of generating my own data, but rather reviewing it. So it's not as second nature to me yet. And I haven't had to apply it as much in the real world. I think a big takeaway, and it's not really surprising for me, that change is difficult. That was just reinforced. It really does take dedicated, intentional, and focused efforts. For plans for ongoing development, I feel that lots of the tools, I might not be completely confident in all of them, so I continue to work through that. I think I'll continue to use an A3 way of thinking and addressing problems as what is the problem that we're trying to solve here and how do we work through it. And I think that I'm very fortunate that I have skilled and knowledgeable colleagues that I'll continue to work through now in the new role that I've taken on with the SAJ, and that I'll be able to rely on colleagues that know these tools and know the lingo and the language, and that people that are smarter than me, like Dr. Babin that I work with regularly, that they continue to challenge you to think differently and to have this tool set in your arsenal to be able to address these very complex problems that we're facing in our system right now will serve me well.